outside a busy cafe in Stafford that's become the headquarters for Cure The NHS, thanks to Julie Bailey, a lady who lost her mum at Stafford Hospital. We're about to hear her remarkable story.
I took my mum into Stafford Hospital. She had a hiatus hernia. Before we went into the hospital, we both believed that the NHS was something to be proud of. We both believed that mum would be cared for by doctors and nurses who wanted to care for patients. Quickly realised after a few days that instead of in a place of safety, my mum was in actually a place that was dangerous. It was out of control. It was that dangerous. After the first week, I realised that I wouldn't be able to leave my mum there alone. She was so unsafe. During those first 6 weeks, I saw things, other patients suffering and going without any form of care at all. They haunt me to this day when I saw other patients suffering. My mum, she had us. I've always said mum was lucky because she had us. The other patients had nobody on those wards. My mum actually overcame the illness that she was admitted with. She was going from strength to strength and she was due to be discharged. But she was dropped by a member of staff on the last hurdle. And from then on she deteriorated over a period of 2 weeks. Final fiasco was a blood transfusion for mum. She should have been given a frusemide to help counteract the extra fluid. But the nurse who came on duty refused to give it her, saying it hadn't been recorded to give her, although I knew it had been prescribed. She refused to call a doctor to get my mum the medication that was required. My mum died a few hours later. I knew when I left there that I'd have to do something because I'd left patients behind that had become dependent on us. We fed, we gave them fluids and we took them to the toilet. So I knew I'd have to do something. So I first contacted my MP, the director of nursing. She said she walked the wards on a regular basis and she'd never seen or heard what I'd been telling her. I contacted my MP. He said exactly the same. He said he met with a wide circle of people and he'd never heard anything like that. I contacted the Secretary of State. He sent me back to the hospital and offered me commiserations on the loss of my wife. That was Alan Johnson. I realised that alone I wasn't going to achieve anything, and if I'd seen those things, other people must have seen them. So I put a letter in the local newspaper and very quickly about 40 people made contact. We formed the group Cure The NHS. I got in touch with the Healthcare Commission and told them about all that had been going on at the hospital and all of our complaints that we'd made. So they launched an investigation. In the year of the investigation, while we were outside on the hospital with our placards asking for the unnecessary deaths to stop, the Chief Executive of the NHS, Sir David Nicholson, called the investigating team together and told them to be cautious with our evidence because we were a long-standing lobbying group. My mum had been dead 6 months at that point. All anybody had to do was to read any one of our letters of complaint or just open a ward door and they would have smelt and heard the suffering, but nobody did. They disputed the mortality instead and set up a different study from the HMSR's, Dr. Foster's mortality statistics.
One of the things you've always campaigned for is this full independent inquiry. We're hoping to get that soon. We know the date now. What are you hoping it will say? What are you hoping will happen because of it?
We're hoping that from the public inquiry, zero harm and right first time will be introduced into the NHS. Introduced decades ago to other industries like the airline industry, the construction industry and the nuclear energy, but nothing like that in the NHS. We just seem to harm so many people a year and it just carries on. Lessons aren't learnt. So we're hoping also a quality and safety management system to be introduced into the NHS to ensure that this never ever happens again.
And you've campaigned for change. You're hoping that your mother's death will lead to improvements. This could affect the whole of the NHS.
That's right. That's what we're hoping for, to ensure that there aren't families like ourselves left behind, left to suffer, because we've had to sit and watch our loved ones suffer and die under dreadful circumstances, and that's something that lives with you forever. You never get over. But we've got to ensure that it stops straight away, and other people don't suffer like our loved ones did.